Okay. Good afternoon, everyone. My name's Alice.
And my name's Trey, and this is our presentation on Advanced Health Informatics.
So really what Advanced Health Informatics is the data analytics that go into the healthcare field. It studies a broad of pretty much everything, whether that's patient feedback, patient care, patient age, their files, their electronic files, etc. All these things, it's just a mass study on pretty much everything in the medical field.
And then, why does health informatics matter? Well, it provides easier access to healthcare and makes it really more convenient and just more efficient for patients and hospitals. Having all the data in one place makes it so much easier to access things, and then also makes it a lot just better to do medical research and produce new medicines, things like that.
So what's been done already, one of the biggest things that's been done is electronic health records. Pretty much all files in the majority of the medical field are already electronic. Some are hard copy, but people just prefer electronic just because it's more organized. Another thing is generative AI. Experiments have been run on specific studies and databases off of specific medical care to run more studies off of it. Meaning, for example, here a big thanks to AI, new cures for a disease in the field of genomics was found, which is in the biomedical field. They got a lot of results from patient care, the patient feedback that we mentioned earlier, and then they plugged it into AI and basically told it to create a cure to a disease based on the information that was given to it. And so what AI does is it analyzes those medical images and then it predicts the outcome of the patient.
And then what is being done currently in the present with the technology and then also the problem? So the current state of the technology is really there's a lot of confusion and controversy going around about AI because it's really new in the healthcare field and it hasn't really been proven or cemented itself. And it's not too many people rely, or they don't feel it's reliable. However, there has been some good things with this new technology, things like remote health monitors and telemedicine, which is essentially just doing Zoom calls with your doctor, or doctor consultations from the comfort of your own home, which has been a really popularized since the COVID pandemic, and that has been a really good use of the new technology that's been going around.
So we're talking about unintended consequences about advanced health informatics. One of the biggest things is data security complications. A lot of people do care about their privacy and where this data is going. They don't really understand whether it's going into the wrong hands of someone or into an AI. They don't know where the data is going to end up. And so really what that leads to, again, is to increase costs and over-reliance on the technology. As this technology, whether it's AI or just simple databases, it's going to keep getting more expensive. Serving it as inconvenient for companies because they don't want to spend more money on something that's going to make them money. And so this is where also digital divide and interoperability comes into play, just because user experience is one of the biggest things out of all of this, just because they have to create a system so where they can find cures, they can find data, they can analyze data without it being too difficult to sustain itself.
And then the future of advanced health informatics, what still needs to be done? The technology in AI needs to be further developed and refined in order for it to really have its place in healthcare. There needs to be data security reform, and they really need to prioritize data security and privacy in order to ensure that patients are comfortable, and as well as them being safe, because a lot of that information is vulnerable to hackers because it's really important information about their health and things like that. So those are two things that really need to be done in order for AI to really take off and reach its full potential in the medical field.
So looking at this is a piece of data that we pulled from one of the research bases that we were doing. Really, if we take a quick look at one of these two bar graphs, we can see here that This says average visit length and average wait time by department. This is taking two completely different things as long as the satisfaction and the feedback. It doesn't just take necessarily one specific area from the field of the building or the doctor's office. It takes studies from everything. So all of these studies and all of this data would be plugged into AI, and then the people or the scientists would ask AI to create a new study based off of this specific data. So really, essentially, what it is just new data off the data that they can put into AI, or they do it by themselves, not AI. So yeah.
And then this is slide is dedicated to generative AI versus our own research. Some of the major things, there was a lot of key differences, but the biggest one was probably how quick and easy it really was to get like really just summary of the basic ideas off of AI. You just really type in a prompt and it just tells you everything that really you're asking for. But as opposed to our own research was really time consuming. However, we were able to go into a lot more depth about our sources and really find like super specific information to what we were looking for. And it's also really credible information that is backed and proven by experts. Whereas generative AI, it is still susceptible to making mistakes. It's not perfect. It doesn't have the latest data. I think it goes up to 2022 on ChatGPT, and I think it's about the same for Bing Chat. Whereas for our own research, we're able to find articles from yesterday about our prompts.
So our conclusion, really what we learned was we understood where different studies are made from different data in the medical field, and that these new technologies have huge potential and they're significant steps into the future for electronic health records in different areas of the study. It's expanding and securing each day. It's really kind of an unpredictable amount of what it's going to do. And back to really the other side of why it matters. This matters because whether you care about your health or not, everyone has gotten a physical, everyone has gotten blood drawn, everyone has gotten a shot. So really this correlates to us because everyone has had some sort of health experience in the past or even now. So really this is why we need the refinement and development and testing into the system, because there could be new cures for diseases that we didn't even know we could make, and then etc. So things in that sort of nature. And then these were just our references of where we got our information from and what we base it off. That's it.
Yep. Thank you guys for watching. Hope you enjoyed our presentation.